I just got diagnosed with ADHD, and I'm trying to wrap my head around it. What even is ADHD exactly? ADHD stands for Attention Deficit Hyperactivity Disorder. It's a neurodevelopmental disorder that affects both children and adults. People with ADHD may struggle with attention, impulse control, and sometimes hyperactivity. So it's not just about being hyper or distracted. The main features of ADHD are difficulty paying attention to work-play tasks, conversations, or personal belongings. Hyperactivity such as fidgeting or being unable to sit still, talking, or thinking a lot. Impulsivity like interrupting conversations and difficulty waiting in line. But some people with ADHD aren't hyperactive at all. I always struggle to stay focused, like my brain just switches channels on its own. Do we know what causes ADHD? The exact cause of ADHD isn't known. It's likely to be a genetic condition which runs in families. Research suggests that ADHD probably results from a combination of several genes interacting with environmental risk factors such as brain injury, exposures to alcohol or nicotine before birth, premature birth, epilepsy, and exposure to toxins like lead in childhood. What kind of symptoms should I be watching out for? Inattentions, hyperactivities, and impulsivity are key symptoms used to diagnose ADHD. Adults with ADHD often have other symptoms too, such as executive dysfunction, which is the mental processing needed to choose goals, make plans, take actions, and keep moving towards those goals. Emotional dysregulation can show up as mood swings, angry outbursts, low motivation, irritability, and difficulty putting up with frustration. Time agnosia, which is difficulty judging in the passing of time, estimating how long things will take, or remembering the order things happen in. These symptoms may not be obvious to others. Many people develop ways to hide the symptoms known as masking. Masking can cause exhaustion and can have negative impacts on your mental health. So what can I do now? How can I manage it? Medicines can be used to support changes to your lifestyle and behavior, but non-medical approaches are equally important. Learn about your brain and join ADHD support network. If you can afford it, consider an ADHD coach or virtual assistant. Share your diagnosis with others who love you. This helps your relationships run more smoothly. Exercise regularly to let off steam. Allow more time than you think you need. Use timers, alarms to manage time and tasks. Structure your days with schedules, planners, or digital reminders. Setting up daily routines will help reduce stress. Practicing mindfulness or yoga is helpful for many people. Use what works for you and let go of what doesn't without beating yourself up. Think of the ways to use interest, novelty, passions, challenge, or urgency to get difficult things done. Consider whether your job suits the way your brain works. If not, can you make changes? Find ways to help you relax, such as listening to music or learning relaxation techniques. Works on ways to improve your sleep. Lack of rest worsen symptoms. Consider cognitive behavioral therapy, CBT. It helps develop coping skills. That was so helpful. Follow Selene the Nurse to learn more about your health.